Effectiveness of contingent screening for placenta accreta spectrum disorders based on persistent low-lying placenta and previous uterine surgery. A large cohort study by Coutinho and colleagues from Fetal Medicine Unit of St. George's Hospital. Placenta accreta spectrum disorders are a recognized cause of major maternal morbidity and mortality, with a prevalence between 0.01% and 1.1% of pregnancies. The incidence of placenta accreta spectrum is increasing globally, and the main risk factors are a history of uterine surgery, such as cesarean section, and a diagnosis of placenta previa. The aim of this study was to evaluate the effectiveness of a screening program for the identification of pregnancies complicated by placenta accreta spectrum, based on a persistent low-lying placenta in the third trimester in women with a history of previous uterine surgery or cesarean section. Two cohorts of patients were included in the study: a screening cohort of unselected women attending for routine ultrasound at 18 to 23 weeks gestation performed by qualified sonographers, and a diagnostic cohort consisting of local and external referrals to the Placenta accreta spectrum diagnostic service that was run by experts in the prenatal diagnosis of placenta accreta spectrum. In the screening cohort, women diagnosed with a low-lying placenta were scheduled for a scan at 32 to 34 weeks gestation. At this assessment, patients with the placenta at less than 2 cm from the internal os and a history of uterine surgery were referred to the Placenta accreta spectrum diagnostic service. Afterwards, all cases with the prenatal diagnosis of placenta accreta spectrum disorders were evaluated by the surgical team, and the final diagnosis was based on intraoperative findings and histological examination of the surgical specimen. A total of 57,179 women underwent routine scan in the second trimester between 2009 and 2019. 415 patients had a diagnosis of persistent low-lying placenta at 32 to 34 weeks gestation, and 220, 0.4%, had a final diagnosis of placenta previa at subsequent assessments. Among them, 75 were referred to the Placenta accreta spectrum diagnostic service because of a history of uterine surgery. This cohort contained 22 cases of placenta accreta spectrum disorders, of which 21 were identified correctly by the screening pathway, and one case was missed because it was a focal placenta accreta spectrum disorder in a non-previa placenta. 173 suspected cases of placenta accreta spectrum disorders were referred to the diagnostic service between 2009 and 2019. There were 1 false positive and 3 false negative diagnoses of placenta accreta spectrum in this cohort. The overall performance of the contingent placenta accreta spectrum screening program, in which women with placenta previa and previous uterine surgery were referred to a specialist placenta accreta spectrum diagnostic service, was sensitivity 95.5% and specificity 100%. The Placenta accreta spectrum diagnostic service showed a sensitivity of 96.6% and a specificity of 98.8%. A screening program for placenta-accreta spectrum disorders based on the identification of women with a persistent low-lying placenta in the third trimester and the history of uterine surgery was both feasible and highly effective. This screening program can improve maternal clinical outcome if it is supported by a multidisciplinary diagnostic and surgical service.